Hi, I'm Dr. Shaina. One of the really common questions we get in PT is, when will I get better? Some of the determinants to the answer to this question would be, how long have you had your pain and symptoms? Another might be, what are your day-to-day activities that you need to do that may or may not exacerbate your pain? Another would be, what are your beliefs about your pain? And of course, we can't ignore the body's process of healing. There's a calendar time for just the body healing, but the great thing is your body's trying to heal all the time. So how do we go about setting goals? There would be short-term goals and long-term goals. Usually the long-term goals look more like getting back to your prior level of function, return to play, either sport or any activity, and prevention of injury as well. So you want to be able to keep yourself from getting injured again. When we look at the short-term goals are more, how do we decrease your pain or symptoms? How do we start to increase your activity tolerance with less pain while you do them? So it would really be determined on what your goals are. Usually the short-term goals, as you reach them, they help to support the long-term goals. If someone is making small progress versus big progress, how do we go about continuing from there and trying to get bigger steps? Progress looks really different. Progress might be decreased pain. Progress could also be you're increasing your activity level and able to do more, and your pain level stays the same. I would still consider that progress, because instead of not really being able to do much at all and having pain, you're actually doing more, and even though your pain level is the same, you're able to do more. We would, again, continue to go further and try to reduce your pain as you keep doing more, but that is still progress. So the mindset and definition of progress has to look at all those different factors. Something to remember is rehab is not linear. Path through rehab can be all squiggled up and down. You can have flare-ups and exacerbations here and there, but that's just your body reacting. And so sometimes the body just needs time to adapt as we rehab you through the process. So when your process goes back and forth and up and around, it does not mean you're not overall getting better. And so when we look at rehab, we want to try to move towards a linear path as much as we can and continue to increase progress, whether it's through decreased symptoms or pain, or increased function or activity tolerance, or just better performance in anything. But then if you do have some setbacks here and there, that still doesn't mean that you've gone down to base one. You're just working through that process to continue to get better, and we want to try to have as minimal setbacks as we can, or minimal flare-ups, but they will happen sometimes. It's pretty normal. Just even in your day-to-day, you do a workout here and there, all of a sudden you might feel really, really sore, but as you keep doing more and more, your body will adapt to it, and you will tolerate that workout so much better as you continue to do it. Unless it's a bad workout that really hurts you in general. But you want to do things that are good for your body, and strengthening is just going to be overall great for your body with anything. So with goals, they're always going to be focused on you. It depends on what you want to do. Your goals aren't going to look like someone else's goals. I can't make goals for you. We have to make them together. If you have any other questions, comment below, give us a call, take a look at our website if you want to look for more information.